we did a systematic review, and Suresh has gone into quite some detail looking at the differences between a systematic and a scoping review. But ours wanted to look at the syndemics of gendered violence and mental health among migrants, and also looking at the evidence, methodologies, and systematic risks or determinants. So that the team I wrote, we drafted and came up with the review with myself and Rumi, so that we could also check each other's work and validate it. And then Anuj, I think most of you have met her, or if everyone. And then there's also Professor Kembui from Oxford, where the main reviewers there. And then also Joe gave some input into this. So like Suresh said, a systematic review is tighter and also looks at answering specific questions. So these were the three questions that we sought to ask. The first one was, what is the evidence, existing evidence relating to the intersecting risks and burden of gendered violence and poor mental health among migrants who are found in precarious situations? The second one looked at the dimensions of precarity that are captured, as well as the socioeconomic determinants and dimensions or pathways of precarity that shape these risks. And the last question looked at how the syndemics have been studied, which is the methodologies, the approaches, and tools. So our methodology followed what has been spoken about the PRISMA, which is the preferred reporting items for systematic reviews, which is the one that we used. And so we developed a protocol that was registered. So a protocol, I think Suresh has already spoken a bit about it, which is kind of the document that details the methodology that you adopt, and that is registered and made available so that anyone who wants to make a similar study or related study knows or can look at what you did. So we registered it on Prospero, which is a registry for systematic reviews in health and social care. So that's the number there. So yeah, I will not dwell much on this, but for our framing, I think you heard Suresh also talking about the concept. So ideally, you want a scaffolding or a framing to use to show that there's clarity and consistency and relevance, especially among the main concepts that you're using and what they mean. So our population was migrants, and the concept for us was mental health plus gendered violence. So what's interesting in looking at this framing is we were looking not at gendered violence and mental health as single issues, but we were looking at their intersecting. If you looked at the question, we looked at how these intersect. So we did not want studies that only focused on mental health or only centered on gendered violence. We wanted studies that looked at both of these at the same time, and also studies that were related to the context or exposure of mental health plus gendered violence plus the risk and precarious situation. So this also helps to frame our inclusion and exclusion criteria, in that we did, if a study does not look at the way we have framed this concept, we would not take a look at the study. And that's our selection criteria, what was included and what was not included. For example, I think what's key to note is our exclusion criteria included grey literature, because we wanted studies that were rigorous in their methodology, that has less bias and so forth. So I think Suresh referred to these as those of their kind of highest quality that you can find. So we also used critical appraisal tools, which is to map the quality and also risk of bias of the studies. And like it said, it's meant really to look at how methodologically sound, ethically robust, and contextually relevant the studies that we looked at are, which also strengthen the credibility and impact of what we say because of where we got the evidence. So for JBI is a tool that is used to appraise quantitative studies, MAAT for mixed methods, ROBIS for evidence synthesis, and CASPIS for qualitative and case control studies. So these are just questions that you ask yourself and try to map against each study that you look at. So I'm not going to dwell much on this, but this was our PRISMA flow chart, and looked at what we included and what we did not include. but we started with 2,610 articles and ended up with 18. So this details how and why duplicates were removed, and I will not dwell on this as I think everyone has an idea of what these are. So the results that we had, so we submitted this systematic review to BMJ Public Health, which is a medical journal. And our paper simply broadly looks at, the first section looks at study information, such as where the studies were located, the designs, the population that we focused, how they were recruited, methodology, and gaps. And the second section looks at what kind of migrant information were captured in these studies, and like population movements and things like that. Section 3 looked at issues to do with risk factors, including social determinants of health, and also health system related barriers around availability, affordability, and so forth. And then section 4 in our paper addresses comorbidities, for example, syndemic or co-occurring conditions, such as you find there's mental health and GBV, but you also have infectious diseases, SRH issues, and malnutrition. And then section 5 looked at precarities. Section 6 looked at mental health, aspects of mental health studies, and then section 7 looked at GBV. So these are just the broad sections which our paper addresses in their context. And I'm not going to dwell on this, but these are some of the graphs that we and charts that we came up with, just to give you an idea that are in the paper. We did not include a lot, but just a few to illustrate. So in terms of looking at the papers themselves that we looked at, most of the studies originated in North America, and it also kind of tells you the kind of where migrants from certain areas are moving to, and also who is doing a lot of the work around syndemics. So that's really why this is coming from, why we have that issue. And we explored some group differences, but they were quite interesting intersections of gender, ethnicity, and class-based inequalities. So because of my time, I'm not going to dwell on all of this, but it just gives you an idea of what so at this point, we're just describing what the kind of, what the studies were looking at. For example, how they framed syndemicity. So a syndemic refers to the co-occurrence or interaction of two or more diseases or health conditions within a population. And we look at how these combined effects can be worsened by social, economic, or environmental, including structural factors. So we wanted also to look at each paper, how do they conceptualize syndemics? And for example, some looked at it as a synergistic and feedback loop relationship with how GBV and poor mental health in vulnerable groups probably affirms their constitutive impact. In other words, when you have these two conditions existing, how do they affect the health and well-being of migrants, and what contributes to these syndemics? So I'm also going to not spend time on this, but just shows how this study. So a lot of this can be similar to a scoping review, just describing what our studies were looking at. But what is important for a systematic review is answering the question. So what we find out is gendered violence and poor mental health co-occur as a syndemic in migrant populations across reviewed sources, and there are overlapping risks. They are shared structural drivers and mutually reinforcing effects. And for the syndemics, for what we looked at, the syndemic of between GBV, mental health, and precarity is shaped by broad 4 dimensions of precarity, which is insecurity, dispossession, disempowerment, and disposability, which leads to systematic exclusion and poor mental health, poor health outcomes for migrants. And we also looked at how migration-based precarities, such as lack of legal status, limited access to care, can amplify trauma, violence, exposure, and mental health distress. So this is now bringing how this synergistic effect between when you find gendered violence and poor mental health within context of precarity, what it does to migrants, and also how structural and institutional violence, when it's combined with deprivation, can constrain recovery and compound vulnerability, which then forms a broader system of inequality that exists within among migrants. So there's also migrants facing institutional violence and status-based precarity. They frequently exhibit mood and affective disorders such as depression, and that also can coexist with emotional violence, which is also consistent with some of the findings. We classified precarity dimensions and mapped them against GV, gendered violence, and mental health. And what we revealed, what it brought out was there is a layered cyclical interaction that is shaped by micro-level determinants. And also, migrants within this interlocked mesh of social and health status remain largely invisible in policy and programs. So you find out when there's programs and policies that respond, they are not effective because they are missing how the coexistence of mental health issues and GBV compounds and reshapes the experience of migrants. So I'm going to okay, so I think what was quite interesting, there's conceptual ambiguity around syndemic theory. So we also looked at what syndemicity means, and there was no coherence or agreement amongst the papers in terms of what that means. So that was an interesting finding. And then methodological limitations included underreporting, lack of syndemic measurement tools. For example, some of the studies did not give us, when they measured syndemicity, did they have when you look at the appropriateness of tools that measure the co-occurrence of these things. So you don't want something that looks at GV and mental health individually, or looks at, how gender violence leads to mental health. No, we wanted something that mapped the two of them at the same time. But then some of the methodological limitations across the studies, including that the syndemic measurement tools are limited, as well as how to use intersectionality or participatory methods within these studies. So one of the major strengths of these reviews is that it was a group protocol. It was developed, there was a very extremely rigorous consultation and peer process. So this is one of the strengths of this review. The conceptual challenges, of course, arise even for us. So we found that in the studies that we looked at, but also for us in terms of conceptualizing what syndemicity means, that also was one of the issues that we dealt with. As there is, an explicit syndemic framing that is agreed upon across the board is not available. But we also conducted comprehensive quality appraisal. For example, I talked about the tools that we used to look at the quality and also risk of bias. And across all the studies, they met the minimum threshold for trustworthiness, relevance, and clarity of results with no bias reported. So when you appraise these tools, if your score is medium to high, then you become worried. But all of the studies, when we appraise them, the score for bias and was low across them. So what we can conclude from this, remember we're asking specific questions. So the conclusions to those questions is that there is substantial overlap in risk factors for gender violence and poor mental health. And these are jointly exacerbated by structural determinants like limited health care, inadequate housing, legal expulsion, and migration-induced trauma, which is the trauma associated with how migrants move from one place to another and during the journey, and also where they end up at. And there's a cyclical relationship between poor mental health and GV. This was confirmed. Gender violence acts both as a cause and a consequence of mental health distress. So this points to a syndemic pattern. And what we also conclude is that the existing literature inadequately explores complex intersectional pathways. They often rely on linear models, overlooking compounded vulnerabilities. This then limits conceptual depth of what you can say about the complex interplay of factors that you look at that co-occur. And then future research should adopt intersectional and participatory approaches that can then generate integrative evidence and support co-designed policies that can disrupt this 360, we call it a 360-degree cycle of gendered violence and poor mental health. So we just mean that when you have gendered violence and mental health, they both exacerbate each other, and compound the whole thing of migrants. What I'm going to do before I finish in my last minute is to show you what a chart looks like that we used. I think that's the only thing that hasn't been shown. I think maybe Joe showed one, but I'm going to just show you briefly the chart. So this, I hope you can see this. So this, what I'm trying to say, what I'm just showing you here is the kind of dimensions that we looked at. So at the beginning, you look at what the study is about, what the research design, just profiling what the study is. And then you look at the study population and the sample size, so some of the methodological issues. And then from then you move to different dimensions, for example, movements, relationship of migrants, population with host participants. So this is what we call a data charting. I think Joe showed one. There's a data charting template that you come up with and say what is coming out of it. So whilst this largely provides quantitative outputs, but also what we did is for every paper we provided kind of a summary. So for the appraisals that I spoke about, we mapped them right at the end. But this also just shows you how comprehensive this can be and how tight a systematic review needs to be. So for example, if the article was qualitative research, we'll then indicate which checklist was used. And then the questions are not showing because it's another sheet that we extrapolated to this one. But it then shows you whether you are answering no or yes. So all of these then add up to what the risk of bias that you then end up with. And for example, you see that all of these ended up having low risk of bias. I think I will end there.
Thank you so much, Tanatswa, and another great input, and yet another reminder of just how much work goes into these and the collaboration. And I think both of you emphasizing the importance of collaborating, co-authors, co-researchers on the projects. So yeah, great job. Any questions, comments, or thoughts for Tanatswa?
Thank you so much, Tanatswa, for a good presentation. And the concept that you were dealing with of mental health as well as gender-based violence. What I wanted to ask or find out, which might be a bit tricky, but I know maybe you might have observed it as you were writing up. How was mental health being reported between maybe as you were doing the data analysis, looking at how was it being reported by the authors themselves, the people who were writing this, and were there instances where you could see it being reported by the participants, maybe in those qualitative kind of research papers, and were there differences in that you might have observed in those reportings? Thank you.
Thank you, Blessing. So how mental health was reported largely had to do with the type of methodology that each study used. So if it was a qualitative study, then you have the migrants themselves reporting. And a lot of the times they use data where they would interface with migrants. And I think the bulk of the studies use data that they gleaned from migrants that were using specific services. So when they go maybe for a visit to a doctor or to a health facility, they'll then be asked if they're willing to take part in a certain study, and then they are then linked to the researchers. And then some were using evidence gathered from other studies, which means they were evidence synthesis that we looked at. But I think the overarching response to that is the methods we used were not necessarily participatory, which then limits the extent to which you can look at the intersections of some of these issues. I think that was the main difference that we saw, that even for some of the qualitative studies, there was no participatory technique that we use in terms of methodologies. But it also maybe points to the fact that there are challenges when you try to look at the coherence of these features in terms of development of appropriate methodological tools to measure a syndemic. So I think that would be my response at the moment. But yeah, unless it was secondary data, they use data that was directly submitted by the participants. In 1 or 2 studies, they use service providers info.
Thank you so much, Tanatswa.
Anyone else? Okay. Melissa.
Thanks, Jo. Thanks, Tanatswa, for such a brilliant presentation. I think I'm gonna throw Blessing's question to you. I think we've said a lot about how this process can be so long, excruciating, and just demands a lot. But I just want to know what were I'm sure we've had a separate conversation on this, but I think it would be very nice for you to share how the process has been with the others, and mostly emphasizing on the good parts of it, just from your perspective. Thanks.
Thank you, Melissa. What I would say is, for me, what was particularly interesting is the whole, I think Suresh talked about how a systematic review and a scoping review are different. But if you see, there's a lot of overlaps in terms of the methodology. It's just that for a systematic review, was the first thing that I looked at. For example, for the first screening that we did, I then realized, okay, we are not getting the articles that we wanted because I had to kind of, you are like, all of you in the group are trying to decide when we say syndemicity or a syndemic, what do we mean? So that whole journey of discovering how to differentiate what I'm doing from a scoping review that others are doing became quite a learning point. And also, so it was kind of something that keeps building up. And I remember when we actually finished the chatting, we sent our work to Cam, and he brought a comment back and said, you have done a systematic review, but your write-up reads like a scoping review. So we had spent some more weeks planning so we did a systematic review, but wrote it up as a scoping review. And then we had to spend weeks again going back to doing a lot of that. So I think for me, that was the caveat, like how then do you report and do a systematic review differently from a scoping review. So that was a good thing. And I think one thing that you mentioned, and I think someone also did, was when you develop your search strings, each database like Scopus, Medline, Web of Science, they use very different syntax rules. So syntax rules are about when you put input, how does the system read what you have put? So where do you put brackets and so forth? So they are not uniform. So you'll find out you have to have a different search string for each database, which also limits the amount of databases also you can do. For example, someone asked Melissa why focus on Scopus and Web Science. Besides the subject matter focus, it was also to do with time, because you have to develop so long search strings that are different for each database, and you have to put them into the system to check if they are returning syntax errors or not. So I think that would be my response, Melissa. Thank you.
Thank you very much, and a thumbs up from Melissa. So great job. Thank you, everybody. I know it's a lot, and I think that this morning's session was really to try and, in one way, emphasize just how much work goes into a scoping review, but also to encourage you to think about opportunities for undertaking scoping reviews, particularly in relation to your own PhD topics, but also in collaboration with others. So huge thanks to Suresh, to Melissa, and to Tanatswa for sharing your work. I've shared their slides in the chat, but also they're in the Google Drive, which I'll continue to update. We've got, I see several of you have sent in your bios, so well done. And I'm in the process of uploading what I have. But everybody else, please remember to do the create your bios and your reflection pieces so that we can get those online. All of the videos and things are also processed now, so those will be being shared. And yeah, all that's really left for me to say is huge thanks, and thank you for being our inaugural cohort. And I will be in touch about having a kind of closing session at some point in person so we can see each other again. That might be during the break, but it also might only happen during term time. But I'm really looking forward to continuing to engage with you and for you assisting us in building the early career research and network within the core. If people are interested in leading with that and supporting getting that underway in South Africa and beyond, then please do connect with me or Surej directly. And we will be having the next South Africa sort of VITS Migration Health Research Symposium as part of the core. We had one last year and we'll have one later on this year as well. So I really hope that you will all participate and be part of this initial cohort of getting this network up and running. It's really there for you. And Surej and I, I'm just speaking for Surej, but are delighted with the level of participation and engagement. The IOM colleagues yesterday asked me to pass on their recognition of the work that you're all doing, and they were very impressed by how smart you all are. I said, I'm not surprised, I know they are. So that was nice to always have that from an outside perspective. But that's really it from me. Surej, is there anything you'd like to add?
No, I actually want to echo exactly what you told Joe. It's always very interesting for me because most of my teachings are actually for European or North American students. So through the core, actually, I'm learning a lot more on what happens in ground reality, how you see. If you remember, I told in the beginning, like truth is always relative. So it's interesting, like how you approach topics and what's relevant for you and how you see things and various kinds of things. So it has been a rewarding and enriching experience for me. And as Joe said, the idea of the core is actually to build capacity to train future leaders. Leaders doesn't always mean to be the prime minister or president, but leaders in their own terms on how to use evidence to inform policy. And as Joe was saying, we are nothing but happy and grateful for the time we had to interact with you and learn how you approach those things. So thanks a lot for Joe, and thanks a lot for you guys for patient listening to us, and wish you all the best for your research and studies. Thank you.
Thanks so much. Thanks so much, Surej. So I think on that high note, let us close this inaugural workshop, this inaugural winter school. And we are looking forward to engaging with you more in the future. If you're happy, I'm going to keep the mailing list going. If you would prefer to leave it, then obviously you're welcome to, but I will use it as a way of communicating with you all moving forward. So please enjoy water. If you have water, stay warm as you can. Those that are traveling, please travel safely. And we'll be in touch very soon. Take care, everyone.